Hi, everyone. I'm Dr. Bimisa Augustin, family nurse practitioner and provider and director of clinicians here at Thrivelab. I'm here with Dr. Trent Nguyen. He is our clinical mental health specialist here now at Thrivelab. He's here to discuss with me the impact of hormones on mental health and also to discuss our new life coaching program that we're now offering here at Thrivelab. So I will pass the reins over to Dr. Nguyen.
Okay, so welcome everybody. My name is Trent Nguyen. I am the life coach and licensed therapist here at Thrive Lab. I have been in this field, let me see, like since 1998, working with various populations. Populations that were court mandated, families, children, even children in foster care due to their parents having domestic violence issues, substance abuse issues, etc. Besides, seeing clients and working with families in groups as well. I mean, I also teach, graduate level counseling students, and these are the students that are training to be, future clinicians down the road. So very nice to be here, and this is a very important topic that we will be discussing today.
Absolutely. Thank you, Dr. Nguyen. I'm so sorry I pronounced your last name wrong.
It's okay. I go by
Um,
Trent. Yeah, Trent. Yeah, Trent
okay.
is
Okay. All right, Dr. Trent. Okay. So I have some questions about the new life
sure.
coaching program here at Thrive Lab. So
Right.
basically, what are the goals of this program?
Sure. Right. Yeah. Yeah. So when a client slash patient comes in, right, I mean, they usually have some struggles, current struggles, and
Mhm.
those struggles do impact their daily life. I mean, and our main purpose is to help all clients slash patients not just to survive on a daily basis, but to thrive. Okay, and at times, I mean, these are the folks that do need some life skills. For example, how to regulate one's emotions and not to be reactive in various circumstances like we all go through. And these days everything is so uncertain. People are ready to snap at one another, and you can see the stress that people go through. I mean, not only at
Mhm.
their places of employment but also their home life. Kids, etc. So folks, are being impacted at all levels. And if you think about the inflation, people these days, I mean, they are just trying to make ends meet, and the stress, the distress that they are in. So our focus, our mission is to really alleviate, okay, their struggles by providing some tools, okay, and to help them have a new relationship with themselves. Because for the most part, right, when we fall short, I mean, we tend to be very judgmental, you know and I usually ask clients, to look at, that relationship that they have with themselves. And the mantra that I usually help clients, repeat is that I am doing my very best under these circumstances. So those are the things that we, help, in terms of like life coaching with our, patients. And for the most part, I mean, for the 90 days, we want to walk with our patients, okay, so that
Okay.
we can look at different areas that they need help with in terms of like life skills, okay.
Mhm.
And after a while, I mean, once they practice this on a daily consistent basis, it becomes, very natural, second nature for them, so that they would not revert to their default ways of thinking, behaving, and feeling, but to be very skillful. Okay, so one thing that I usually like for clients to know is that we cannot control other people's behavior. The only two things that we
Absolutely.
control is our cognition. How do we modify our thinking so that it can impact our emotions? Okay, and the emotions basically will determine the behavior that we exhibit, and that is not based on external factors, right? I mean, we cannot expect other people to act appropriately, all that, because again, that is our preferred, reality. But reality is not like that. So we owe it to ourselves to be very skillful in terms of our responses to
Mhm.
others' behaviors and not to be reactive. So both, professionally and personally. And I think that is huge because that does impact one's self confidence, self concept, self identity.
Absolutely. Is there a specific time frame which you set for the patient or give them a goal in order to achieve these coping
Sure.
skills?
Definitely. Yeah. So for the very first session, right? I mean, we use that session as an assessment session to look at
Okay.
what are their like current struggles, and we usually look at the most urgent needs first. Okay.
Okay.
So if a patient says that, hey, I do have a tendency to think negatively about
Uh,
myself as a mom, as a dad, as a worker, and all that, so we look at those areas so we can strategize. Okay, so for example, how to tolerate the distress that one is in, how to replace those negative self-talk with positive ones. What are some of the activities that a client can engage in on a daily basis to increase their positive emotions? So again, I mean, we act as a coach, to really walk with our patients. So from the get-go, we will look at those areas, that we focus on, and then the following sessions, we look at each one of those goals. Okay, and
okay.
the thing that we usually ask our clients to engage in, for example, is like to really have this mindfulness mindset. Okay, to be fully present, right, and not to kind of like multitask and be pulled in different directions. And the rationale behind that is to really reduce the stress. Okay. So again, the
Okay.
mantra is that I am doing my very best under these circumstances. And then I am not a superhuman, right? Again, I mean, that radical self acceptance is so crucial. And I think once
Absolutely.
a person shifts that paradigm, right, shift that mindset, then they can accept where they are, the things that they can do, with their best ability. And that's all it matters, right? Yeah. So again, I
Okay.
mean, the very first session we engage in the assessment. What are the areas that they struggle the most, and then the following sessions, right? We look at one of those goals and then provide the different tools that they can utilize. So our perspective and philosophy is that we treat the whole person. Okay, not just their
Absolutely.
symptoms and all that, because we are very holistic, very integrative, and that is our mission and our philosophy.
Okay. All right. Awesome. So, how would you say our hormones and our mental well being are connected?
Sure. Right. Yeah. It can be, interconnected in so many levels. So, for example, if a person is having like a thyroid problem, for example,
Hmm.
no doubt, I mean, they will be impacted emotionally, mentally, right? So it's almost this interconnectedness. So, and when one is highly stressed, I mean, that impacts the hormones as well. Okay, so one of the feel good hormones that I usually talk about with clients is endorphins, right? I mean, and we can produce that type of good hormone by exercising, for example, by taking care of ourselves, and this has to be like on a consistent basis. And for the most part, people think that when I self care, it's kind of like selfish, But the main thing is that we cannot give what we do not have, right?
Absolutely.
So the saying almost like when even when you are flying with a little kid, right? And you are the first person that you put the oxygen mask on first, okay, in order to be effective,
Yep.
in order to help others, right? So when a person, and I have had clients that said that, but I'm not into like exercise and all that, and I usually say, you don't have to do like half an hour of vigorous, moderate exercise. For example, walking around the block, right? And they say, okay, I'll give it a shot. And then as they walk, right, you see the body produces endorphin, and then they feel so great, And
Yes.
then the main thing with changes like this, I mean, a person can be very gung ho, from the beginning, and then 2 weeks in, right? part of their, we call this dialectical tension. It's like a part of you knows, right, what you need to do to get well, to feel great and all that. But another part of you kicks in and say, hey, I feel so fatigued today. I feel so tired today. Can I skip this? And one of the
Mm-hmm.
skills that we talk about is opposite to emotion. Okay, meaning that if your emotions may, be like fatigue, you feel demotivated and all that, right?
Right.
And I usually say that you do what you know the outcomes will be, and then the emotions will catch up. Okay, so we apply to this exercise example, right? A person continues to walk and engage in different physical activities, right?
Right.
And in the beginning, they say my emotion is not there yet, but after like half an hour, 20 minutes, you see the hormone endorphin, right, occurs,
Right.
takes place, and now they say, hey, this is so awesome, and that is opposite to emotion technique. and
Ah,
and when
okay.
we do that, right, it's like we do what we know is best for us, and then the emotions will catch up. All the negative ones tend to disappear, and the positive ones do occur. And patients, feel like, hey, this is within my control. And those are the things, that we talk about in terms of like focusing on what one can control and let go of the things that one cannot control. And again, two things that we can control, right? All cognition. We can modify our thoughts. Okay. And then the next thing is that we can control our behavior. And those are the things that one can control. And they engage in those activities on a daily basis, right? And they are in a different place. Okay. And they have those tools, those skills, right? And as time progresses, I mean, they can be independent and utilizing those skills for the rest of their
R-
lives. And the main thing, I like about, this profession is like this. The ripple effects are so tremendous, meaning that
Right.
if I could help a mom or dad, and that is like a direct cause, right? A direct, effect. But also, if you look at the indirect effects, is that if a mom, if a dad, right, they feel great about themselves. Okay, their hormones is no longer imbalanced now. They will have a different relationship with their spouses, with their kids, with their co-workers, etc. So again, back to this holistic philosophy, right? It's like one area of your life that is improved, it also improves the other areas
Exactly.
of your
It's the
life as well.
trifecta. Yes.
That's right. That's right. You see,
Mind, body, and soul.
that's right. Yeah,
Yes.
and I have seen this over and over again. That even one's finances improve as well, and their
Mhm.
eating patterns also are affected. They are no longer emotional eaters, right? But they are very intentional. They eat for the nutrition, not to numb the emotions that they try to negate.
Right. And then in turn, it affects their health,
That's right.
and things like
That's
that.
right.
Totally understandable. The way in which I see, well, I'm going to read something reproductive hormones, how they actually regulate our, parts of our
Sure.
mental health, especially for women, because
Sure.
in a lot of cases, most women are referred to, you know, psychiatry, and it's, oh, well, you're mentally depressed, or or there's anxiety.
Mm.
Well, let's kind of figure out why. It could be your hormones. So that's why the whole holistic thing is very important to me, because
Yeah.
you do have to care for mind, body, and soul as
Right.
well. So for example, hormones like estrogen and progesterone are primarily female hormones, right? They help control things like menstruation and pregnancy. Testosterone, primarily male, but yes, women do make it. It's a sex hormone, and it helps control, like, libido,
Mm.
muscle building, and brain fog.
Right.
Women need this as well.
Mm.
We have stress hormones,
Right.
okay? Like glucagon, cortisol, adrenaline, and this helps regulate blood sugar levels,
Right.
and how we respond to stress, right? So there we go. We can help with that. We can help, bring on those coping mechanisms
Mm. Right.
that can help make our lives a lot more positive, right?
Mm. Mm.
um so we have insulin also too, which helps us absorb and process sugar, uh glucose,
Mm.
from food, right? The thyroid hormones, which help our body run efficiently, efficiently, right? So we're a well-oiled machine, like
Right.
a car. So it affects energy and weight,
Right.
right? And so when these things are like out of balance or they're off,
Mm.
uh, signs and symptoms such as obsessive and or negative thoughts, right? And feelings and emotions,
Mm.
irritability, anxiety, depression,
Sure.
mental health or mental fatigue and sluggishness,
No.
trouble with focus and concentration,
Mm.
memory loss, inability to cope with stress, and insomnia and or trouble sleeping. This has a complete negative effect on our body. So mentally, it can depress us,
That's right.
you know, and so literally caring for mind, body, and soul, you know, taking care of these hormones will help you develop, and feel better mentally
Right.
across the board.
Definitely. Definitely. Right.
Do you agree?
And,
Yeah,
and I
absolutely.
agree. And the beauty with Thrivelab is that we have different professionals with different areas of expertise, you know. So again, I mean, if they need like medical advice, all that, then we do have those professionals. And if they need like life coaching, I mean, I'm here, for them so that we can,
Absolutely.
provide the techniques, the tools that they can utilize, and for the most part, I mean, some folks may feel very confused, what is happening to me and all that because of that interconnectedness. Once they understand that,
Hmm.
right, then they say, hey, I'm just going through this process, and it has to do with aging, as well. Okay. So if a person has like too much stress that they can, not handle, right, that affects the hormones,
Right.
tremendously. So that creates that, all the imbalances in their own system. Right.
Hmm.
Mhm.
So you gave an example earlier of doing something healthy and fun that can help us release endorphins, make
Right.
us feel better, right? Um, Exercise. What are some of the other healthy habits or choices that we can
Sure.
make in
Sure.
order to help us mentally, you
Right.
know, flush the negativity, I
Right.
guess?
Right.
What are some of the
Definitely.
other healthy habits?
Yeah, I would say that nutrition impacts us
Hmm. Hmm.
tremendously, not just the physical health, right? But whatever that we put in our mouth, I mean, impacts us mentally, emotionally. The latest research that I have read is like, for example, like fast food, I mean, can have an impact on a person's emotions. Okay, for
Hmm.
example, it can cause depression, believe it or not,
Wow.
I usually talk about that, with clients. I mean, be sure, that the foods that you eat, I mean, very clean, all that. So, and also another thing that one can do is mindfulness practices on a
Right.
daily basis. And for clients who have never done mindfulness practices, they may say that, how long do I do this? What do I think about? When I am,
Hmm.
sitting still, right? And I say it is very simple. I mean, you don't have to do like half an hour and all that. Start with 5 minutes, okay? And they can get hooked. And the reason why, because when we do mindfulness, right, we basically give our brain, our body like a rest, a break, okay, and that can energize ourselves, okay, and they may say that, hey, 5 minutes is no longer enough. I want to do like 10 minutes, on and on and on.
Absolutely.
Uh, you know, I had tried this back in the '90s, and in one sitting, I could do it like for 4 hours straight. Could you believe it? Okay.
Wow.
So some of the techniques, I mean, can be very simple, right? Just focus on your breathing, okay? The
Mm.
breaths that we take, okay? Because when we do that, right, different thoughts that do come up, different concerns, anxiety, and all that. Hey, what about this test? What about that test, and all that? And I tell clients, not to worry about them. Just acknowledge that you have those thoughts, those concerns, those emotions. Just acknowledge them. And the main thing with emotions is like they are like messengers. They are like
Mm.
messages telling us, right, that hey, we need to do this. All concerns and all that. So once we acknowledge the presence of the thoughts, emotions, concerns, and all that, and then redirect our attention back to our breathing. because this is like the essence of life. Can you imagine if you have all those concerns and then, you could not breathe, for the next 5, 10 minutes? Life would, will cease, right? So this is like the
Yes,
essence, the
absolutely.
foundation of life right here. So that's all it is. I mean, you just, you know, redirect your attention and say, I am in the present moment. And it teaches our body, right? Say, I can be calm. And that becomes a habit. So that is one thing that I do, twice a day. And also at the end of the day, I look back at the day, right? And always close my day with gratitude. Okay.
Yes,
Because
absolutely.
social psychologists have demonstrated that we humans, right, tend to tilt to the negative. Okay, let's say
Absolutely.
that we
Hmm.
have like 5 events, right, that happen in the during the day, and let's say four of those events were like positive. You know, we are so enthusiastic, so happy and all that, and then one negative event that takes place. Guess what? We tend to
That's what
tilt
we
to the
focus
negative.
on.
You see, and we
Exactly.
maximize that negative event. But what about those four positive events? You know, why do we tend
Exactly.
to minimize them, right? So when we have this gratitude, it's like we tend to focus on the positive events and maximize them. And with like the negative event, right? Let's say that if we did fall short and we say, hey, okay, what is the lesson learned here so that I can improve? You know, again, having that radical self-acceptance, but at the same time, right,
Absolutely.
this desire, right, to become the best version of who we can be. Okay, areas
Absolutely.
for
Yeah.
improvement, and not because like I'm so afraid that I fail, but hey, this is like self-actualization, that we want to be the best person that we can be, the best
Hmm.
version as time progresses. So those are the things that I do. Also make sure that we sleep well. Okay, at least 7, 8 uninterrupted. And that's like the
Absolutely.
the main thing, uninterrupted sleep. Okay, nutrition, meditation. I mean, those are like the main things. And also, believe it or not, I mean, in this country, I mean, loneliness is an epidemic. Okay, meaning that
Yes.
not having connections with others for various
Hmm.
reasons. People may be too busy, afraid of others. You name it. But having those connections are just like oxygen to our lives, right? Without that, I
Yes.
mean, and we learned that from the blue zone people, right? I mean,
Yes.
all the five blue zones, the common denominator is that they are connected, with others in their communities. Okay, so that's a lesson
Absolutely.
that we can espouse and to practice in our in our lives.
Oh, that's awesome. Absolutely. So our CEO Josh host, awesome guy. He always talks about on our Thursday morning meetings, practicing gratitude. So that's
Okay.
something I have adopted on a daily basis.
Mm.
Okay. And it does make life a whole lot better,
Sure.
a whole lot more simple, even with all the difficulties, that we face. Um, so on a I guess on a personal, um, story on a personal level. I myself, I'm a patient at Thrivelab as well. Okay, I in the past, I have a psychiatrist and a psychologist. Yes, I was in the military,
Mm.
but it was every diagnosis that I felt like known to man was thrown at me: insomnia, depression, um, um, with anxiety, of course, PTSD.
Mm.
Um, and it was just like, I know I'm not a depressed person. Yes,
Right.
it doesn't matter that, deployments happen. I mean, it was a choice. But the medications that I was on, I didn't feel
Mm.
like myself. You know, I was on at one point Ambien, then Lunesta, um, Bupropion, um, Zoloft. I mean, it was just nothing worked.
Sure.
Nothing worked at all. And so I met Katie Joe, she came on board, she became my provider,
Mm.
and we looked at my hormones, and we did find out that I had an underactive thyroid, and
Mm.
also too, my hormones were jacked.
Mm. Mm. Mm.
I'm still a young woman, but I'm a perimenopausal woman. And I was like, that's where the depression was coming from.
Mm.
And it was just like an up
That's
and down type thing, because I know I'm not a depressed person. And there's nothing wrong with that. But It was like, it's just something wrong. I don't know why I was feeling that way, but
Yeah.
now I know why.
Right.
So even with ongoing, um, mental health, practices that I
Mm,
do, I still go see my psychologist and
mm,
psychiatrist. I do feel better knowing that I don't have to depend on medications in order to help me feel better. I'm able to cope a lot
right.
better,
That's right.
and I feel a lot better. And not to mention, I'm
Mm.
still talking about the 42 pounds that I lost.
Wow.
Have a great diet. Have a,
Mhm.
the outlook on life is like
That's right.
totally
That's
different.
that's right.
So
Yeah.
Thrive Lab has, again, I will say it, Thrive Lab has been there to help save my life.
That's right. That's right.
And I love it. I do have quite a few patients that are no longer on mental health medications because
Right.
they're able to cope now,
Right.
because they're getting the help that they need, not only with their hormones, but
Mm.
also too with their mental health professional to
Well,
be able to cope
that's
with
right.
the
That's right.
difficulties
That's right.
in
Yeah.
life.
Yeah.
um
Yeah.
Dr. Trent, do you have any stories, or any success stories?
Yeah. I would say that my wife is a retired pharmacist, and the main thing is we tend to believe that food is medicine.
Yes.
Okay, and even when we have like colds and all that, we don't tend to take medications at all. We tend to eat the right foods and all that. And to the main thing is to focus on the stress, to reduce the stress level, because we try to look at the chronic inflammation in our bodies, okay, based on the foods that we intake, based on our responses to circumstances, and daily physical activities. I mean, we cannot underestimate that,
Yes.
because that's like the ingredients for healthy life. And besides that, I mean, we also focus on spirituality as well. Okay,
Absolutely.
spirituality here, not like go to church or religion, anything like that. I mean, a person can be spiritual, and they may not be religious at all. Spirituality, in a sense, is like I have this respect for nature, for example. I believe, that something is greater than myself. Okay, that I am put here on earth, to carry out a mission, things like that, things that are bigger than myself, than me, and that gives us meaning. Okay, because every day,
Absolutely.
if you
I
think about
agree.
every day is like a gift, not a right at all. Okay, so every chance that we have, that we be grateful, and not to be afraid to commit any acts of random kindness, to folks, because we may not know, that
Right.
smile,
Right.
that gentleness, that
Yeah.
encouragement can do so much for those people, and we may not see the ripple effects, at all. So that's how we, live our lives. Very grateful, and because I was one of those boat people, from Vietnam.
Hmm.
I mean, back in the late 1970s, and we stranded at sea for days. You know, and we thought that, hey, this is it. And believe
Wow.
it or not, about 500,000 boat people died, in the ocean, and we were so
Wow.
lucky. We were rescued. You know, and that moment changed my life forever. Okay,
Goodness.
and yeah, I want to be that stranger. To have no hesitation to help people, and that impacts that person. They help me, right, because they will look at, man, I didn't do anything. And they tend to replicate that. You know,
Mm.
and that is the ripple effects. I mean, that I would like to see, on and on and on. And I was talking, with my friend the other day, that, hey, this is the legacy that we leave behind. And we may not see the facts, but never hesitate, to really, use kind words, encouragement, you know, so that people could feel like, hey, I am significant. Because if you think about
Absolutely.
the two things, right, that everybody wants, love and significance. Okay, they never have enough of those two ingredients, right? So they always say, "Hey, I accept that. I mean, I receive that, no problem." So yeah. But anyway, I am very grateful to be alive. This is like almost like a bonus, right? Like a second chance, to be
Absolutely.
alive and to make an impact. Right? Yeah.
Yes. Wonderful story. That is awesome.
Mhm.
So we are so honored and blessed to have you, Dr. Trent, on board with us.
All right.
Um, we do offer life coaching services and nutrition services and hormone replacement therapy services at thrivelab.com. So go in, find out all the information that that you want on all of these services, and
Yeah.
then sign up if that's something that's right for anyone, family members,
Yeah.
whatever, you can bring them on board. We have all licensed professionals on board with us. We'll get you in as soon as possible, and then get you going on this journey for elevation of mind, body, and spirit.
All right.
Thank you, Dr. Trent.
Okay. Thank you so much, Dr. B. All right.